Okay, hi, my name is Mel, and I'm going to talk about puberty blockers and other, I am gender fluid, so I am trans, and I think there's awful lot of harmful misinformation about trans people and puberty blockers in general out there. Now, I am not a medical professional at all. I just have a very bare basic understanding of this. But I would talk to non-religious secular doctors and professionals about this. If you are trans, or if you've got a young person in your care who is trans, you need to be dealing with ethical medical professionals. And I say secular because I've never met yet religious organizations. They tend to try and drive the demon out of trans and gay people, or enforce gender conformity, which is enormously harmful and dangerous. So one of the big things that goes out there is that puberty blockers can cause permanent infertility, and they do not directly cause permanent infertility on their own, but they can pause fertility while you're taking them. So if a young person pauses a medication and allows a natural puberty to resume, their body will typically develop mature eggs or sperm as normal. However, the long-term impact on future fertility will depend very heavily on whether the person transitions directly to cross-sex hormones. And there are things around that could be thrown. So while taking puberty blockers or GnRH analogues, the body stops producing the natural sex hormones, estrogen or testosterone. This pauses the maturation of sperms and eggs, meaning you cannot biologically conceive while on them. And generally they try to keep people on puberty blockers for about 2 years, okay? Decades of data from children who use these blockers to treat central precocious puberty or very early puberty show that once the medication is stopped, regular puberty and normal fertility resumes. So we do know that it is entirely reversible, okay, and safe as anything else can be. Now, the risk of permanent infertility significantly increases if an adolescent moves directly from puberty blockers to gender affirming hormone therapy like testosterone or estrogen without ever letting their natal puberty finish. But there are dangers in letting their natal puberty finish too, because the ovaries or testicles never had the chance to fully mature. They may never be able to produce viable eggs or sperms. Okay, there's a risk. It's not something that's guaranteed. But that's something that, with the young person and competent medical professionals, a discussion should be had. Because the problem is, if someone goes through puberty without puberty blockers or cross-sex hormones, their bodies can produce in ways that are very hard to reverse. So if someone is transgender, while there are a lot of surgical options out there and they're great, it can often be very difficult to reverse some things that can happen during puberty, okay? And for some people, gender dysphoria is very, very real. And I think it's very important that we understand that the psychological well-being of the person taking puberty blockers or cross-sex hormones usually has to take predominance over any sort of fertility issues, and the ability to how we're going to be able to, if that becomes something that they want to do, to start doing surgeries to make their body more one sex or the other. Okay, fertility preservation options. Okay, so there are some options that could be taken, and I'm not going to recommend them. I think it's up to like whether the doctors or medical guidelines do this or not. They should receive, every family should receive, and youth should receive detailed counselling about all of this, fertility and otherwise, before starting any medical treatments, okay? For natal males, if a person has reached a stage of puberty where they can produce sperm or semen, sperm can be collected and frozen before starting gender-affirming hormones. For natal females, egg freezing is a common option, although it requires undergoing a hormone stimulation process and invasive retrieval procedure, which requires a certain level of physical maturity. Pre-pubertal options for young children who are having the puberty block at a very early stages. Freezing mature eggs or sperm is not possible because the body has not yet created them. There are other methods which are highly experimental, and depending on what you sort of look at, debatable how well they works. So puberty blockers are very medically important because they pause the physical development of secondary sex characteristics, giving gender-distressed young people time to mature before making any permanent decisions. So, preventing irreversible physical changes for transgender and gender diverse young people, undergoing natural puberty triggers physiological changes that match their birth assigned sex but conflict with their gender identity. This can cause a great deal of many problems. For natal males, blockers prevent irreversible voice deepening, facial growth, and masculine facial bone structure. For natal females, halts breast development and the onset of menstruation. And reducing the need for reducing future surgeries. Preventing these failures early significantly reduces or completely removes the need for highly invasive surgeries later in life, such as double mastectomies or facial feminization or bottom surgery, like with creating a vagina or a penis or whatever. It elevates gender dysphoria and mental distress enormously. Peer-reviewed science shows that science demonstrates a direct link between physical changes of puberty and spikes in acute distress, anxiety, and depression in transgender youth. Symptom reduction. So the JAMA Network Open, so studies produced in major medical journals that show access to pubertal suppression is associated with 60% lower odds of moderate to severe depression and 73% lower odds of suicidality. So this is a case of if you want them to not kill themselves or not harm themselves or not feel really crappy and horrible and whatever, then puberty blockers are an enormously good idea. Quality of life, showing that stalling unwanted physical changes resulted in documented improvements in quality of life, psychosocial functioning, and general well-being. So buying time, they buy time for cognitive maturity. The human brain undergoes massive cognitive emotional development during early adolescence. Pressure-free decisions by halting distressing physical body changes, the young person, their family and care team can navigate gender exploration without the ticking clock of unwanted puberty. Informed consent. Delaying irreversible changes allows the youth to reach an age of greater cognitive maturity and executive functioning, ensuring they are better equipped to provide truly informed consent for permanent medical transitions later in adolescence. So look, I just want to put some context here. While major paediatric societies support their use, it's important to note that global scientific consensus is always evolving. Systematic reviews in archives of disease in childhood point out that while many and most individuals experience immense relief, some cohort studies show mixed or relatively low certainty long-term substantial evidence regarding universal psychological improvement. Look, because of this and because a lot of other reasons, global guidelines heavily emphasise that puberty blockers should never be and can never be a standalone solution, but rather part of a comprehensive, individualised psychological and medical care plan. All right. So evaluating a person, so a person, like, if you're going to, look, someone, they need to have gender informed care, gender affirming care. So that primarily a lot of it is counselling, especially for younger children, is counselling the child and their family to help them understand what it is they're feeling and going through. Okay, and that always beneficial. And then it's like they can socially transition, so they can go by whatever name or pronoun they want, use whatever toilet they want, dress however they want, and that everyone just gets to accept it and love them anyway. There you go. That is the best thing to do. It's up to the rest of us to change society so that, like, people who are different are accepted. It's not on these children or transgender people like me we cannot conform to what you are. We just cannot. It's not it's impossible. All right, and you shouldn't want that either, because you don't conform to what you think you are either. I've got to tell you that for nothing. But so evaluating a person for puberty blockers requires a strict set of clinical criteria coupled with active monitoring for known physical side effects. So medical teams globally rely on evidence-based protocols such as World Professional Association for Transgender Health standards of care to ensure medical interventions are appropriate, safe, and timed correctly. The criteria for medical teams to initiate puberty blockers. Before any medication is prescribed, a multidisciplinary team, usually comprising a pediatrician, pediatric endocrinologist, child adolescent mental health professional, must verify specific eligibility requirements. And the child should be in counselling for probably a good couple of months before you start looking, unless it's severely urgent, and it could be, but you should have them in counselling from go, right? Onset of puberty, the patient must have entered the early biological stages of natural puberty, right? Typically defined as Tanner stage 2. Blockers are not given to pre-pubertal children, or if they're after puberty, that either. There's a different sort of thing then. You are looking at cross-sex hormones at that point. Comprehensive psychological assessment. A mental health professional must evaluate the youth's emotional functioning, developmental history, and support system. They must ensure that any co-occurring mental health conditions like depression, anxiety, autism are being actively managed and stabilized and being dealt with. Like, deal with them as a whole person, Informed consent. The youth must demonstrate the cognitive capacity to understand the treatment's effect. Traditionally, their legal parents or guardians must provide full informed consent. Now, this can become problematic. So, because I know a lot of young people have had to go to court to have themselves emancipated or taken out of guardianship of their parents because the parents are virulently anti-trans. But generally, like, that is so fertility counselling must discuss that, okay? Obviously, as part of puberty blockers or cross-sex hormones. Side effects and medical monitoring. While puberty blockers are largely well tolerated and their primary effects are reversible, suppressing sex hormones during key development years can introduce specific physical risks that do require rigorous clinical oversight. Bone mineral density issues. Puberty is a critical window when the body rapidly builds bone strength and density. Because blockers temporarily shut down estrogen and testosterone, this rapid bone mineralization can slow down. The Endocrine Society has a protocol that recommends that youth on blockers have their bone density monitored through regular DXA bone scans. Doctors frequently prescribe vitamin D and calcium in supplements and advocate for weight-bearing exercise to support bone growth. So this is what they do to try and help modulate. The catch-up peer-reviewed data shows that bone density generally catches up to the expected levels once adolescent either stops the blockers or transitions to gender-affirming hormone therapy. Growth and height alterations. So the risk. Sex hormones trigger the eventual closing of the growth plates in long bones. By blocking these hormones, the skeleton may continue to grow slowly for a longer duration than expected, or they may be shorter than expected. So the protocol, doctors track height and calculate bone age every few months using specialized x-rays to ensure growth remains within healthy biological limits. Menopausal-like symptoms. So the risk is crashing the body's natural sex hormones can mimic temporary menopause or andropause. So patients may experience hot flashes, mood swings, night sweats, and headaches, particularly if blockers are initiated a bit later in pubertal development. Teams monitor these symptoms closely and can adjust dosages and delivery methods if the discomfort is impacting daily life or health. Future surgical limitations. For individuals assigned male at birth who start blockers at the absolute earliest signs of puberty, the penis and scrotum may not grow enough to provide adequate tissue for traditional vaginoplasty procedures in adulthood. Surgeons have adapted alternative surgical methodologies such as issuing tissue graft to socially circumvent this anatomical limitation later in life. And look, this is important. Like, so all of these sorts of things is needed to be looked at, okay? And this is where obviously having a team of people that can sit down with a young person, their carers and guardians, to talk about all of these issues. But the worst thing you can do is try and pretend that children or youth going through, like who are questioning the gender are somehow wrong. Like all children and youth will probably question their gender at some point, some more seriously than others. It is part of natural development. However, for those of us who are transgender, and I'm gender fluid, you can say non-binary, I think those of us who are transgender, we cannot make ourselves cisgender. We cannot possibly turn our gender to the sex we're assigned at birth. It is just not possible for us to do so because sex, as in your biological sex, which is not binary, despite what you might have been told, and gender, which is also not binary, are not the same thing. They both exist on a spectrum. Okay, and I think it's vital that we stop persecuting and putting like laws against transgender people. We are not the threat. Believe it or not, men don't go around wearing dresses and makeup just so they can get into the women's toilets to abuse women. They don't need to dress up to do that. They can just do that. I actually think unisex toilets are a good thing. We have cubicles from floor to ground with appropriate security precautions, so everybody's safe, but there's that way who cares what sex or gender someone is. But the problem is, especially in America where they've got all these bathroom bills, where women who don't appear appropriately feminism enough, which would be, I guess because I was assigned female at birth, would be me, I told to go and use the males, and I've used the males here in Australia, sometimes asked, sometimes unasked. I don't give a shit, but like other women, that's put them at risk. And then also too, they're saying they should use a toilet assigned at birth. So if they're a a woman that has had gender confirming surgery to be a male, you are now asking a male to step into a female's toilet. I mean, it seems ludicrous in its law. Stop all the laws and the trans hatred. We exist, we're no threat to you, and our rights should be protected and guaranteed as human rights, because we are human, and like, we're not sinners, we're not broken, we are just people who, probably genetic reasons amongst others, are not like you. Does not mean we're bad or wrong or horrible or anything else. A little bit of like inclusion and just basic dignity. I mean, like, if you were cisgendered, so you're not like me, trans, then I'm no threat to you. I can't possibly do anything to you. You cannot make someone trans. By educating people about trans issues, you cannot make someone trans. You cannot not make a child trans. By educating them all about gender and sex, you cannot make them trans. It is just not possible. Okay? You are born either trans or cis. You were born gay, straight, lesbian, bisexual. You cannot make someone be other than what your genetics and, whatever else is. I mean, and the complexities of how your genes and different, like chemicals and hormones and all that operate in your brain and brain structure in terms of sex and gender are very complicated. It's not a single thing. And also environment. I don't mean by environment which we live in, although that's probably not helping. I mean, I'm talking the environment in the womb that we all developed in. That does have something to do with it. So we should not be. This is not something that's broken that needs fixing. This is something. It's being transgender. It just is, and some people need help dealing with that. A lot of people need help dealing with it because society has these very rigid expectations and discrimination against anyone who's not seen to be appropriately masculine or appropriately feminine. And I think there's an awful lot of bigoted nonsense out there. And I think this is where a lot of we are all somewhere on the gender spectrum. No one's 100% anything. I can tell you that for nothing. But I think to say what a man is or what men do or what women do, that's ridiculous because it's changed through the centuries as what we thought. So I think this is definitely, and unfortunately, religion and a great deal has caused a lot of harm to LGBTQIA people, such as myself. And I think that is problematic because, look, I mean, I don't believe in a God. It's got nothing to do with being gender fluid. I'm an atheist because I can't find any good or even reasonable evidence for any God. I don't even know what people mean. When they try and describe a God, I'm like going, how do you know that's what a God is? I mean, gods, by any definition, are not falsifiable or testable. But I mean, look, if you do believe in a God, okay. I mean, I don't believe belief is a choice either. I don't see it as being one. I mean, I was brought up in Christianity. I was a Christian for a long time until I started questioning it. And then once I started questioning it, oh, well, bam, I became an atheist. Wasn't entirely comfortable. It wasn't much fun, but I got there. But I think I'm not like, gender fluid people or trans people are not, we're not anti-God or anti your holy book. If you think your God or holy book's against us, then that's a problem with your book and your God. It's intolerant and it's bigoted. Like you're saying God created male and female. Like, I'm sorry, that is enormously ignorant and horrific, quite honestly. And the treatment of women is an issue too. I mean, like, I think this is now my sexuality is different from my gender expression. I have a different, like, my sexuality for a lot of the part is asexual, but not all of it. Sometimes if I'm attracted to anyone, it's males. It's not that anything wrong with females, I'm just not attracted to them, right? But like, my sexuality, I don't have an enormous drive in sexuality. I definitely am romantic in nature. But like, I'm just wanting people to understand that gender, sexuality, as in biological sex, I'm not talking about the sex you have, or that is a different conversation again, are all varied. It's a rainbow. And it is vital that we understand that people who are transgender like me, we do need community acceptance and support. And if a child or young person needs gender affirming care, so that could be counselling, social transition, puberty blockers, it could be cross-sex hormones and surgeries. It could be, if they need that, determined by a secular team of good medical professionals who are working with the young person and a good guardian of that young person who's not, bigoted against trans people for whatever reason, need to work through and look at a lot of details, but certainly counselling and social transitions are options children should have. And I mean, puberty blockers are vital for many to stop basic psychological harm. I mean, I don't know how else to say this to you. Do you prefer a dead kid or a live one? I mean, this is just what it comes down to. I mean, like, we all need to improve our acceptance of people who are different. Okay, so that's me for now. And thank you for your time.